A lot of debate out there as to what is the perfect time frame. For patients that are suffering from periodontal disease, gum disease, we recommend routinely that they should go and see their dentist every 3 months. The reason is because they'll be able to do a rather simple form of cleaning and an examination on these patients to make sure that they're keeping the periodontal disease in check. And once again, for those who are more susceptible to cavities because of either their diet or medical conditions, we're aware that a lot of our population are on a whole series of medications.
Yes.
And a lot of these medications cause dry mouth. And if you suffer from dry mouth, either from Sjögren's syndrome, which is an autoimmune disease that causes dry mouth, or if it's because you're on a lot of a variety of medications, you are more susceptible to getting cavities. So it's very important for those who are more susceptible to cavities or those who have or are suffering from periodontal disease to receive more frequent dental exams. And I would recommend seeing those people seeing their dentist once every 3 months. For the rest of us, once every 6 months is a minimum.
And what about children's dentistry? How soon should a child see a dentist?
That is so important. There's a whole concept right now called a dental home. And what we as a profession are trying to promote is that every child should have and establish something called a dental home by the age of 6 months to 12 months. By the age of 6 months, a lot of times we're going to see the first mandibular central incisors grow. It's very important that we create a preventative regimen for our kids. They should come in, they should have the dentist examine the child and provide them with a particular location where they can receive all their dental care. At age 6 months, the dentist isn't going to do much. Just a little bit that early, just a little bit of just an exam, and probably clean their teeth just a little bit. At the age of 6 months to 12 months, it's recommended that you put a little smear of toothpaste on a toothbrush and have the mom, and in this case in the exam the dentist, brush the teeth very, very gently. And beyond that, you can put a pea-sized, at age about, say, 12 months beyond till about age 2 or 3, a pea-sized amount of toothpaste on the toothbrush, and the parents could help brush the kids. By having an early appointment at such a young age, we develop a rapport between the child and the dentist so that they're not going to come in at age 3, 4, 5, and 6
be terrified.
And be terrified. They'd be used to us. And in addition, there wouldn't be any reason to be terrified because you know why? Because we'd have preventative care being conducted. We'll be able to treat disease or any cavities before they get worse. So that's so important to have our kids see their dentist.
Cleanings. Yes. Why should people have cleanings?
Well, I'm sure all of us are doing a wonderful job brushing our teeth 3 times a day, but sometimes we get deposits like calculus, which is a built-up of when plaque, you know, the gooey, yellowy, sticky stuff, when that becomes calcified, sometimes it's very, very hard for us to remove it at home with our toothbrush. So by going to the dentist, they should be able to observe areas that you're having trouble brushing and removing these very, very difficult buildups and preventing them from causing your periodontal disease, preventing the plaque and the calculus buildup from causing cavities. That's why cleaning is so important.
Should people use dental floss? You always hear everybody saying use dental floss. Is it important?
It is very, very important. It's very, very hard sometimes to reach the embrasures, the contacts between the teeth. By using dental floss, you're able to remove a lot of this buildup that accumulates between, meals, and prevent this from causing, once again, building up, aggregating, collecting bacteria, and causing cavities. Cavities, I think most of our viewers probably know this, is really caused by harmful bacteria breaking down sugars and producing acid. And the acid basically dissolving tooth structure, which is made out of calcium. So by removing these harmful bacteria and reducing the volume of bacteria that we have in our oral cavities, we can help prevent the prevalence of tooth decay. So that's why cleaning is so important, flossing is so important, brushing is so important. These are all mechanical ways by which we can remove the buildup of bacteria from our oral cavity.
So a couple of other things, root canal or caps, what does that happen even if we do the right thing? And do you do that at your office?
We do. I personally do. I do a lot of root canal treatments. We call it endodontic treatment.
Okay.
And we do caps. We call those crowns. And we also have a couple of specialists in our office that also perform the treatment.
Do you whiten too?
Yes, we definitely we cover the whole spectrum of treatment for all our patients, but we need to concentrate more on avoiding the need for a root canal treatment. Every time we get a patient coming in to see me for a consultation for an endodontic treatment, a root canal treatment, there's this general fear that this is going to be an extremely painful procedure.
Is it?
It isn't. It is absolutely isn't a painful procedure. Surprisingly enough, a lot of our patients fall asleep because they're so bored from us working on them. It takes about 35 minutes to an hour to have an endodontic procedure complete.
Why do you need it? What are you doing when you say root canal? Are you replacing a root in the tooth?
We're not replacing the root. As we mentioned before, when cavities develop, and it is allowed to develop, or sometimes in very few instances, trauma, when a person has facial trauma from a fall, and sometimes you can actually see a tooth discolor. When this occurs, what's going on is the nerve, the blood supply inside the tooth has been compromised, and the tissue inside the tooth is dying. It's necrotic. And it doesn't always cause pain. And this can be necrotic, once again, because of trauma and because of tooth decay. When a cavity has occurred and the cavity has gotten inside the nerve of the tooth, it causes a reaction inside the tooth. And unlike other parts of our body, the blood supply, the tissue inside our tooth can't swell up because there's nowhere to swell up. So the tooth basically, the blood supply suffocates the tooth because of the swelling. The swelling can't basically complete itself, so the tooth dies, necrosis occurs. This is pretty much a very simplified view of what's actually going on. The death actually occurs not instantaneously, but it occurs in stages. That's why you could have a dead tooth or a partially dying tooth for a very, very long time before you suffer any kind of pain. So once the tooth dies, an inflammatory reaction occurs at the root of the tooth. And this buildup of pressure is what actually causes pain. So when you hear horror stories about dental pain, it's actually a buildup of pressure. Now, when you have a buildup like that, if it is not treated and it doesn't drain, the infection continues to grow and it can drain to other parts of the body. It can drain to other facial areas, making it difficult for you to open and close your mouth. It could drain until under the eyes. There's been instances where it can affect your vision when it does affect the ocular region. There's been cases where the infection has traveled to the back of the throat